Are you ready to hear a truth that will shock you? Did you know that after having a tooth extracted, your jawbone starts to deteriorate, and if you don't get any treatment, you could lose more than half of your jawbone within 6 months? This level of bone loss can mean you'll need a bone graft to get a dental implant, and most importantly, it can damage your appearance. Hello, I'm Dr. Etmadi, dentist, gum, and implant surgeon. In this video, I'm going to talk about a treatment that slows down bone loss or even prevents it completely. Socket preservation surgery. So if you're planning to get an implant but don't have the right conditions yet, don't miss this video because I'm going to talk about a treatment that can prevent many bone grafts and the extra costs you might have to pay. I kindly ask you, if this is your first time visiting my channel, please make sure to subscribe and like the video as well. Alright, let's learn more about socket preservation. Our jawbone is a living tissue. It is constantly undergoing construction and remodeling. On one hand, old and worn bone is removed, and on the other hand, new and healthy bone is deposited. This process happens so that the bone can adapt itself to the pressures applied to it, and at the same time, any damage to the bone can be repaired through this removal and deposition of bone. Under normal conditions, there is a balance between bone resorption and bone deposition. The pressure you apply to your jawbone through your teeth while eating signals to the bone that this process of bone resorption and formation needs to take place. So when you extract your tooth, these pressures are no longer applied to your jawbone. The bone no longer sees any need to adapt itself to the pressures. Bone resorption occurs, but the amount of bone deposition happens very little or may not happen at all. As a result, over time, our jawbone undergoes resorption and becomes thinner, and this bone loss means that if you ever want to get an implant, you may need bone reconstruction or a bone graft, which is definitely costly and not cheap. So, what can we do to slow down the rate of bone resorption? How can we reduce the speed of bone resorption or prevent it altogether? The recommended treatment is socket preservation. Basically, it's a kind of minor graft that prevents bone loss. So now the question is, how should we perform socket preservation treatment? Socket preservation is a type of bone graft, but it's much easier compared to the classic bone graft. In this procedure, after your doctor extracts the tooth, they clean the socket, the hole left where the tooth was. If there's a cyst, they remove it, then fill the socket with bone powder, and after that, they place a layer over it, a collagen membrane, so that the bone powder doesn't come out, and then they suture the gum over it. There are various types of bone powder that can be used. It might be taken from your own body. That means they might use bone from your own body, or they might use a synthetic bone powder which can be sourced from humans or animals. So now the question arises, under what circumstances should this treatment be performed? The most important situation where this treatment is recommended is when you want to get an implant, but currently you don't have the right conditions for it. Maybe you want to get an implant a year from now, or maybe you want to get an implant 2 years from now. By performing this surgery, you've prevented bone loss or at least slowed it down. As a result, when it's time to get the implant, you might not need a bone graft at all, or at most, you'll just need a minor bone graft. As a result, your costs will be reduced. Similarly, if you want to get a bridge and you don't do this treatment, over time, the bone in that area will resorb and there will be a gap under your bridge. A space will form between your gum and the bridge, which will definitely look unattractive. It will also cause food to get trapped. By performing this surgery, we can again prevent bone loss and this problem will no longer occur for you. Well, based on what I've just discussed, your mind is probably full of questions right now. So in this part of the video, I'll answer some of the common questions that my patients usually ask me. First of all, does this treatment hurt or not? I have to say that this treatment is not painful. The same local anesthesia you used for tooth extraction is sufficient for this treatment as well. Secondly, is this treatment expensive? I have to say that this treatment is costly, but its expenses are much less compared to the costs of bone grafting. Of course, there are some costs you will have to pay. Bone powder will be used for you. Grafting materials will be used for you, but the costs are much lower compared to bone grafting. And third, who are the people that need to undergo this treatment? As I mentioned, all individuals who are not able to get an implant shortly after tooth extraction. And the next question is, why do you need to use bone powder and grafting materials? I should say that bone powder acts like a structure, like a scaffold, which helps bone-forming cells to penetrate into the area between these grafting materials, leading to better bone formation with greater cohesion, and it prevents bone loss. If you have any other questions about this treatment that are on your mind, Be sure to write them in the comments so I can proudly answer them. Well friends, now that you've learned everything about socket preservation, now it's time to decide, do you want to be the person who later says, I wish I had known sooner, or the one who with a small expense gets the treatment done, saves their smile, and saves money? I hope this video has been helpful for you. Please, if you have any questions, be sure to write them in the comments so I can gladly answer them. And if this is your first time visiting my channel, make sure to subscribe and don't forget to like the video. Until the next video, I leave you in God's care.